Talking about the patient comfort related to the design decisions where to put the electronic. It's just plainly a millimeter more in thickness of the sensor might be considered from most patients as unneeded. So there's a certain thickness you need to have for a dental sensor which is digital direct, but you should not overdo this by placing everything you can into that housing. Talking about the image quality or the different aspects impacting the image quality. I once have been taught by a guy that you should think of it as a chain of points. The chain starts at the X-ray source, or even more precise by the human operator selecting the factors of the exposure. It goes through the patient's head, through the object. It's the physical properties of the sensing detector. It's the physical properties of the A to D conversion, and then it's a lot of software. And that is again, the Zuniray sensor is trimmed by the dedicated team in California to optimize all of the aspects Zuni has an impact. So we take the huge variation from the different X-ray sources as a given fact, which is the framework for our sensors, and we do a lot of things to perfectly trim the physical properties of the detector to the computer, and we deliver a technically image which then is in our software prepared to be displayed in the dental software. And then we do a lot of further processing, provided the customer wants it, in the Professor Zuni software. So the imaging chain starts from the X-ray source, operated by a human, goes through the patient, goes through the physical properties of the detector, goes through the knowledge how to make that X-ray image a digital image, and it's furtherly impacted by all of the software means and filtering and display helps in the software. And then it goes to the display, which needs to be matched somehow into the human observer reading the X-ray image on a screen. The Professor Zuni software provides a huge variation of features to adapt to the very different tasks a customer might have for that sensor. We have a lot of freedom, a degrees of freedoms to customize the Professor Zuni software to the preferences of the user and to his viewing conditions in his laboratory. Talking about the acquisition time, again it's a question. It is not necessary that the fastest is the best, because if you drive the acquisition time to the limits, you might sacrifice your noise performance. The Zuniray sensors are just designed to be as fast as needed by a full mouth series, where you have a few seconds between the next image. And so we use that framework to use the time we have without disturbing the customer's workflow to optimize our technical parameters.